Hello and welcome to TEDMED's Great Challenges. Today we're going to be focusing on inventing wellness programs that work. I'm Basa Chaudhary and I'm going to be moderating our session. It's going to last around 60 minutes. Welcome everyone and thank you for joining us. This session is part of the Great Challenges program, which is sponsored by the Robert Wood Johnson Foundation. The goal of the Great Challenges program is to focus on 20 of the most difficult challenges that we face in health and medicine. These are things for which there isn't a direct solution. There's not one magic bullet that's going to fix them. So what we're going to try to do today is, rather than try to come up with the solution in 60 minutes, we're going to try to just help everyone understand the underlying dynamics, the underlying problems better. We'll be taking questions from viewers who want this to be as interactive as possible, and we'll be taking questions from Google Hangout. We'll be taking questions on Facebook and Twitter. Just so you know, our handle on Twitter is @TEDMED, which is just @TEDMED. And just tag your questions, great challenges, and we'll try to get to as many of them as possible. As I mentioned, I'm Basa Chaudhary. I'm an internal medicine physician. I work in the research division at IBM. And my work largely focuses on how we can apply data analytics and technology to improving healthcare delivery. We have a tremendous panel here today. Welcome everyone. Thank you for joining. Everyone's got a tremendous set of accomplishments. The bios are on the TEDMED website, so just so we can move the program forward, I'm just going to do very brief intros, and I hope everyone follows up on the website to get a better sense of what everyone's up to. So we have Elisa Mendel here, who's the Vice President of HealthWorks and Product Innovation for Kaiser Permanente. You have Jared Kogan, Chief Product Officer from Photocracy. We also have Richard Tallens here from Photocracy. He's the co-founder and Chief Growth Officer. You have Dr. Rajiv Kumar. He's founder and CEO of ShapeUp. Shuma Panse is joining us today. She's the Senior Manager at GBC Health. And Lauren Koretsky, who's Director of Account Management for Provent Health. Welcome everyone. Thank you for joining us. So before we get into a discussion, just sort of open it up, and before we take questions, you know, what I was hoping we could do is just start out thinking about wellness, how to develop wellness programs, and what everyone is up to. And just really briefly, I think this is an issue that's been very close to the heart of things we've thought about at IBM. Several years ago, you know, we kind of looked at what are we doing in healthcare medicine? What are we sort of doing overall? What's the direction we're taking the company in? We're the largest employer in the world. How are we addressing these issues? And we looked, you know, we really thought that we need to develop a lot of innovation and refocus what we're doing and make prevention and wellness a real cornerstone of how we approach these issues. So we instituted, after this really serious rethink, we instituted a bunch of different programs. I'll just go over a couple now just to give people examples of what people are doing to promote wellness. We went to zero benefit deductibles for preventive services. So all recommended preventive services are zero deductible. We did the same thing for all primary care services. And that was sort of a couple of the big things we did inside the medicine system, or the medical care system. We also really actively engaged the model of primary care medical homes. To try to focus and update on health and wellness, we created a set of incentives that focused on health and wellness for our employee base. These were things like health risk assessments, better eating, living, fitness, children's health assessments to get children and families to think about nutrition in a different way and think about activity in a different way. There's over 90,000 IBM employees now participating in these activities, and just one piece of data that I think is really striking. We found that, you know, for employees who are active for at least one day a week, their healthcare costs are $535 less than sedentary employees. So again, just sort of one data point on sort of what some of these programs can do. So that's just a snapshot of some of the things that IBM has been up to. And you know, if we just go around the panel, that would be great, because I'd really like to hear what everyone's ideas on on wellness models, how we can diffuse these kinds of things. So I'll just open it up. Rajiv, if you wouldn't mind starting, that would be great. Oh, Rajiv, I think you're muted. One of the.
Can you hear me now?
Yes, yes.
Okay, great. So I'm from a company called ShapeUp, and our angle on wellness is that the best way to activate, engage people, and change their behaviors by leveraging their trusted social network. So while we're doing a lot of similar programming that others are doing around nutrition, physical activity, stress management, and so forth, we're trying to bring a social element to play where people are leveraging their friends, their family, and their colleagues to support them, hold them accountable, and increase their chances of actually meeting their health goals. And so we're right in the corporate wellness space. We sell mostly to Fortune 500 companies and to health plans. And we're trying to help them take their population and bring people together in a collective effort to achieve their healthy goals.
Great. Thanks so much. Oh, Rajiv, I think you're on mute again.
Sorry. There we go.
Okay. Elisa, would you mind telling us what you guys are up to?
Sure. At Kaiser Permanente, we are both a deliverer of healthcare and an insurance company, and so we think about things first from as the physicians and network that deliver care. And one of the things that we do really well is make sure that people take care of the basic things like getting flu shots, cancer screenings, knowing your numbers, basic biometric information. And we do a lot to encourage people to make sure that they are up and they have full information about what their issues are. And then there's also, similar to other things that are mentioned, we engage with employers who are buying insurance through us to make sure that their employees are taking full advantage of either programs that the employer themselves offers or things that we offer in terms of health education, lifestyle coaching, a bunch of different things that that can help people on their journey. But I think one of the most important things that we are doing is trying to engage the community and sometimes employers as a community around understanding the environmental issues that really drive health, and really taking steps to make sure that the healthy choice is the easy choice, whether it's at work or in their community or when you come and see us.
Great. Jared and Richard, you're both with Photocracy. Please share with us what you guys are up to.
I'll let Richard go first.
Sure. So Photocracy is a fitness social network that really helps people get to the next level of fitness. What do I mean by that? We try to make people rewire their brain and think about fitness a little bit differently. A lot of people, have reasons that they are out of shape or fitness isn't top of mind. But when you think about basic activities like eating, sleeping, sex even, people always find time for those activities. Fitness should really not be any different. And so what Photocracy does is it employs methods such as gamification, a lot of social engagement, because we've seen that is super effective. It takes those methods, wraps it around in a platform, and gets everyone thinking about fitness in a different way and making it a huge part of their life. We've seen a lot of people kind of take the, fitness and health should be a cure, or there should be a cure to obesity approach. I think Photocracy really positions it as, preventative health is the main issue at hand. So that's what we're trying to do.
Terrific. Shuma, if you could let us know what you guys are thinking about this area.
Sure. Hi, Shuma Ponce. I'm with GBC Health, and we are a business coalition. We're focused on global health issues in low and middle income countries. And our history is really rooted in the HIV/AIDS movement. We started off working on HIV/AIDS workplace programs in sub-Saharan Africa. A lot of multinational companies operate in South Africa and other countries hard hit by the AIDS epidemic. We help companies develop workplace programs around those issues. Nowadays, we're seeing an interesting shift from more infectious disease type programs in developing countries to broader non-communicable disease and chronic disease programs in low and middle income countries as well. So we're seeing a lot of our member companies interested in developing programs in emerging markets and developing countries for chronic diseases and the same types of things we see here in the United States and in Europe. We serve as a convener and a connector and share of best practices across our members and other partners working in global health.
Wonderful. Thank you so much. Lauren?
Hi, I'm Lauren Koretsky. I'm with Provant Health Solutions. Here at Provant, we are a national health and wellness company. We work with employers across all 50 states to essentially assess and determine the major risks within the employee population and then focus on the whole person health. So really not just one specific intervention, but looking at comprehensive solutions that really enable participants to address behavior changes, goals, barriers, and have those resources and tools that they need to make those adjustments in their lifestyle to eventually migrate risk for both themselves and the employer to reduce healthcare costs and also ensure a better quality of life. We do that through biometrics, through health assessments, coaching, online technology solutions, the full comprehensive suite, because we know that people have different areas where they're going to be most met for behavior change, and we want to make sure that we can address all of those different areas to increase the likelihood of making the most impact for the employer.
Wonderful. Thank you, everyone, for the terrific descriptions. I think it's really interesting how different the models are, where areas of overlap are, so hopefully we can get into some of those issues. So what we'll do now is we'll just move to questions that people have been sending us through the different outlets that we touched on before. And it's interesting, one of the themes, that I think even came up amongst the panelists was really, the issue of incentives. Some of the things that people described were, how do we make the healthy choice the best choice or the easy choice? How do we get people thinking about, what kind of decisions they're making? So one of the questions, we got through our social media outlets was on this question of incentives. And specifically, here's the question. What about incentive programs in general? And in particular, if we have to pay people to do something, it doesn't seem like it will last in the long run. So that's our question. So, but what I'd love to hear from the panelists is sort of what is their thoughts on incentives? What are their thoughts particularly on financial incentives? What is the role of that within different wellness programs? So I'd like to get everyone's thoughts, but just if we could have maybe Rajiv start just to kick it off.
So we have some interesting thoughts on incentives, and we've thought a lot about it. We work with a whole range of employers that really run the gamut in how they have structured their incentive programs. And what the best analogy that I like to use to kind of think about incentives, and especially when you talk about financial incentives, is if you think about a child and his or her grades in elementary school, right? And we have some parents who will actually pay their children to get A's on their report card. And so if you think about it, what's going to happen in the short term, that child might get A's, and then maybe you're paying $1 for every A or $5 for every A. But as that child grows older, they're going to want more money, right? And when that child turns 16, maybe they say, I want a car to get all A's on my report card. And so you have this little bit of a slippery slope that happens where there are diminishing returns over time. The other problem you have is, are you actually teaching that child the value of education for the sake of education because it's good for him or her in their life and that it's enjoyable and the journey itself is something that's worth engaging in and succeeding in? So I think that analogy, what it does for me is it highlights some of the trouble with financial incentives. Diminishing returns, kind of making it more transactional, taking the focus away from really what's important. And so we like to talk a lot about social incentives and how do you provide recognition, how do you tap into intrinsic motivation to get people to do healthy behaviors or undertake wellness because it's good for them and because they want to do it. I think one of the things we've kind of resigned ourselves to accepting is that financial incentives for health and wellness are here to stay. And so what we have to try to do is work with employers and health plans and try to understand what are the best ways, if you are going to use money, to motivate behavior change. And I think behavioral economics is providing a lot of examples for us. And if we're going to use money, what's the best way we can optimize that money and do it in ways that are maybe more sustainable and that maybe can help tap into some level of intrinsic motivation. And so, a lot of employers are toying with different behavioral economic theories like uncoupling an incentive. So instead of bundling it into a premium, offering it directly as a cash reward, chopping it up into smaller bits instead of making people wait a long time, give them instant gratification for making small changes so they can build healthier habits, and so forth. So I think we're trying to find the balance between non-monetary incentives, social incentives, tapping into intrinsic motivation, and the use of financial incentives. And I don't think anyone's quite got it right. I won't claim to say that, at Shape Up we've quite figured it out, but I think there's a balance there. And I think one of the things collectively as a group that we can do as health and wellness leaders is think about what is that balance and what's the right blend and recipe for motivating people to change their behavior.
Great, thanks so much, Rajiv. That was terrific. And this question is a very rich one, but we have a number of questions. So what I'd like to do is just get a contrasting point of view or potentially contrasting point of view. So Jared and Richard, just because you guys, what you guys are doing is quite different from what Rajiv is up to.
Right.
How do you guys think about this issue of incentives, particularly financial incentives? How do you make them quote unquote sticky, so to speak? How do you make the effect last?
So we don't focus on financial incentives. We really rely on a system, the two-layered system of gamification and community, like Richard already mentioned. So what those two things do at a very base level, the community aspect of it is, fitness is something that's incredibly personal to people. There's a lot of psychological issues associated with it, self-image, etc. And you need to be very, very careful with how you operate, particularly in the consumer space if you're using social motivation. So typically what will happen is someone will come into photocracy and they will join a series of groups where they can join people with similar interests, whether that similar interest is, say, running, strength training, yoga, ballet, Battlestar Galactica. There are groups for all kinds of things. And typically what will happen is you'll create a very human connection with other people who might be in your same demographic, and they will begin to motivate you. So they will help you through any sticking points that you have in the long term. Now in the short term there's also the gamification aspect. So what happens is you come in, you track a workout, we give you points, you level up when you get enough points, and you also have achievement badges and you can complete quests which give you these little dopamine hits along the way. And the combination of these two things, it leads to what sort of Dick mentioned earlier about rewiring the brain. And I think the financial incentive thing is still very much up in the air, and what we've seen and all of our data tells us that what really has led to long-term success in terms of transformations has been this social system that is built around people. I don't know whether, Dick, you want to add anything to that.
No, just to reiterate what Jared is saying, we've looked at a lot of users who've been on photocracy and made huge transformations. They've lost 50 pounds, or they used to hate exercise and now they work out 3 to 4 times a week consistently. None of them think about fitness using extrinsic motivators. They all think about fitness as something that's super top of mind, and they all enjoy fitness, right? It's not something that they have to, they have to tell themselves, should I make this healthy decision? It's not a huge decision like that because it's already really hardwired into their brain at that point. So I'm not a big believer in financial incentives. It might be good to get the ball rolling, but at some point you really need to switch over to other things like social incentives.
Great. So what's really interesting, again, it's a really nice, I think, range of perspective there. So we have, we talked about some of the more traditional approaches to incentives, which are often financial, but here we've talked about issues. How do you really think about behaviors? How are they placed or contextualized within some kind of social system? How do people respond to that? And I think that's really nice because these are really complex behaviors, and the better we can understand them, the more likely we'll be able to change them. Lisa, I'd love to get your thoughts on this, particularly from your roles at Kaiser, internally, from your own organization, working with patients, working with employers. How do you think about this?
Yeah, one of the things that I see happens that people get in a trap is that they think that the financial incentives are sort of the ultimate or the one thing that they're going to do as employers, and for all the reasons, I think Rajiv said it very well, all the reasons that he said, there's actually good data that it doesn't work on a sustained basis. It can work to get people to do a one-time thing that they maybe wouldn't have done otherwise, like take a health assessment, but in terms of changing lifestyle, it's a much more complex set of decisions and emotions that go into it, and if it was only about finance, we wouldn't have the obesity epidemic we have today. So I think that what I usually tell employers that are doing financial incentives, and I agree, it's probably here to stay, and there's a lot of them, that it is fine if it's one of 20 things you're doing, and it is actually from a communication standpoint, it's some very strong messaging about how much a company takes seriously the health of their employees, and they're literally putting their money where their mouth is. So it's good to add to the portfolio, but it should never be the only thing.
Great. I think those are the really important points, because when we talk about these kind of issues, it often does kind of boil down to things like, well, how do we basically pay people to think about their health in a different way? Or that's oftentimes sort of what the conversation gets down to. And this is like a really great set of perspectives. Lauren, what are your thoughts on this? How are you guys thinking about this particular problem? Lauren, are you on mute?
Sure. So we work with most of our employers that we work with do off. No, I'm not. Is that better?
Yeah, please go ahead.
Can you hear me?
Yes, we can hear you.
Okay. Okay. So most of the employers that we work with do offer financial incentives, and in and of themselves, financial incentives may not cause behavior change. We find it's actually the experience of success of attaining a goal that you've placed, and then feeling better, whether that's feeling better through, feeling healthier when you walk up the steps, getting better sleep at night, feeling less stress on a day-to-day basis. We actually see that day in and day out with our participants who come on site to tell us that they did come up, prior year for the financial incentive because they felt that they couldn't walk away from that dollar, but they learned something, or they experienced something in and of that moment that spoke to them in an intrinsic way and chose to make behavior change thereafter, and saw those small little victories that they had, and that in itself motivated them to continue with behavior change.
Great. Thanks everyone for those responses. Incentives, it's one of the questions that always comes up on this. So I'm really happy that we were able to get that, from our audience, and really get to that first. 'Cause, it is a really difficult issue. But I think the point that, kind of emerged from the panel really is sort of the complexity of it, how we have to target a bunch of different areas rather than just sort of one to really get at these kind of complex behaviors. And, I think this is really what, we're trying to talk about here today in the Grand Challenges series. So I'll move on to the next question. We can talk about that incentives for days probably, but let's get to another one. And this is from Kate Wool, and this is on Twitter. And this is a terrific question, and it's asking a really fundamental one. So, is there any real evidence that employee wellness programs create behavior change? So, the first question, we have the question of incentives, and this is really the question of evidence. And oftentimes in healthcare or medicine, we think about evidence as research, but there's different kinds of evidence for different kinds of decision making. So, Shuma, you really sort of straddle a bunch of different worlds here. It's really interesting what you guys are doing, both sort of in different countries and sort of globally. So, what is your perspective on evidence and how the different parties you're working with think about data and what evidence they have for different kinds of health and wellness interventions?
All right.
Oh, Shuma, yes, please.
Yeah, remember to unmute myself there. It's a really interesting question, and I think in the low and middle income country context, we're still in a learning stage when it comes to chronic diseases. There's lots of evidence around behavior change for HIV, tuberculosis, malaria, sort of more traditional infectious disease programs. But with chronic diseases, diabetes, hypertension, cardiovascular disease, we're still learning and building the evidence. That said, there are several successful models that we've seen through our member companies. One that comes to mind to me is Unilever has an excellent global workplace wellness program. It's called the Lamplighter program. And what they do is they have these sort of personalized assessments, personalized risk assessment scorecards. So you fill out a risk assessment, and then based on how you do on that, you have green if you're good to go, orange if you're kind of in a danger zone, and red if you're really in the danger zone. And so that has actually led to a lot of interest and good data and outcomes for Unilever. In fact, in India, they found that over half of the employees who were in the red zone, after realizing where they were and taking participating in the interventions, moved out of that danger zone into the safer category. So we're seeing that evidence in low and middle income countries is growing, but we do have a long way to go. So
terrific. And then Elisa, could you comment on that as well, just maybe from a different perspective on some of the evidence that you guys have accumulated or think about in Kaiser?
Sure. So there is definitely evidence out there that these employer programs can make a difference. And you asked the question, like, does it make a difference in their behavior change, which is sometimes a little bit harder to measure, but other things that employers can measure in terms of absenteeism or productivity or even medical trends to some extent, that there is some early evidence that there is a positive effect. So I believe that the way I think about it is that I believe that the power of the social network that other people here have talked about, when you go to change behaviors, you need a lot of reinforcement. And where do you get a lot of reinforcement? Where do we all spend most of our waking hours? Well, we are at work 2,000 plus, if not more, hours a year, and that the power of your workplace as a community to help reinforce behavior change is very real. And in some ways, I think that some of the change, if it's not happening at the workforce, I think it is difficult to do it on your own or do it in other places. So I feel very positive that there has already been positive results, and that more and more employers are understanding their role in all of this. And besides having individuals feel healthy and feel better, they're also more productive, happier. There's some interesting studies going on about that they are linking the underlying health and well-being of employees to the financial output and success of operating units within companies. So it makes a lot of sense, and I think that it's a powerful vehicle.
That's terrific. I think some of the research in this area has shown that when you look at some of these issues, for a lot of companies, the losses due to diminished productivity, absenteeism, those kind of issues actually surpasses the amount that companies will wind up spending on these kind of health and wellness programs, and also sort of a good chunk of their healthcare expenditures on the whole. And that's, I think, really sort of part of how when we think about what is the intervention, what is sort of the benefit of it. That really large area of productivity is a really important one. I'm going to switch questions and probably switch points of view a little bit here now. We've talked in the first two questions about employer-based interventions. We got a really great question that I think is a really important one, and it's roughly this. An increasing number of workers freelance. Where can they turn to wellness programs? And I think this is a particularly timely question because as we move forward in healthcare reform, more and more people are going to be getting insurance through exchanges, and that's going to be individual level insurance. So this question, I think, applies to people who freelance, but a growing segment of the population as well. So Jared and Richard, I'd particularly like to get your point of view on this. For people who are outside, say, an organized employer wellness program, what are you guys finding, and what are your thoughts on this?
Yeah, so obviously there's a lot of crossover for what we do from consumer space into the workspace. And it's kind of a very interesting position to be in, because one of the things that a good fitness program will give you is increasing confidence across the board. So like we sort of talked about before, there's a lot of issues with knowledge out there, so bad knowledge. There's a lot of confusion about what someone should do. And what products like Fitocracy and others out there do will help you understand your options a little more, but help you find the right fitness path for you. So obviously strength training isn't for everyone, and running isn't for everyone. But if you are a freelancer or you don't have any kind of program, we can sort of guide you in the right direction. And over time, you will, not only will you have more confidence in your current program, but like we said, it becomes more of a lifestyle choice. And this is something that kind of can continue over time, and it becomes, you get to a point where rather than trusting the first article that you read online and going down the wrong path, you start to get a bit smarter about your decisions, and it becomes much easier for you to sort of take care of your own fitness. And fitness is kind of this funny thing because it's one of the only things that you can really, really own in life. So as we all know, there are plenty of people out there that don't enjoy their jobs, plenty of freelancers that work crazy hours, or if you're in a startup, you're also working crazy hours. You might not like the person you're working for, but once you get to a point of owning your own fitness path, it gives you a tremendous amount of confidence to carry on with that, but also that feeds back directly into your work every day.
Excellent. Richard, your thoughts?
So pretty much what Jared said. I will say that because of my background, right before photography, I did freelance. A little bit on my background, I used to actually hate exercise as an adolescent. And what I found as a freelancer who didn't have healthcare because I was in between my job and starting photography, I found that by keeping fitness top of mind and really having that knowledge base that Jared mentioned, and figuring fitness out, I didn't necessarily need any sort of wellness program. I mean, obviously you don't want to be somebody who is a freelancer and not with health insurance. But that being said, I think that it doesn't really make a difference as long as you think of fitness as something that is top of mind and a huge part of your life.
Great. Rajiv, you're part of a really interesting program, Shape Up Rhode Island. I know that had a significant employer presence there. But can you talk about sort of your approach to community engagement around this issue, particularly for people who might be freelancing or working on their own?
Yeah, I mean, so I think there are a couple things that are happening and that we've seen be really successful. So I got started in this whole wellness space when I was a first-year medical student, and I became frustrated that in medical school, starting from the first day of medical school, that we spend so much of our time learning how to treat disease and manage chronic disease as opposed to how to prevent it in the first place. I mean, I think it was probably 3 years into medical school before any of my professors mentioned the fact that type 2 diabetes was actually reversible. And it was kind of like an epiphany. Wow, we have so many diabetics in this country. 2/3 of all of us are overweight or obese. Why are we not focusing more on prevention instead of disease treatment? So I began to work with my patients and try to understand what was the barrier that was preventing them from losing weight, from eating healthier, from being physically active. And the truth was almost all of my patients were struggling with achieving those goals, and most of them were failing. And once in a while, I would see somebody who succeeded, and when I talked to those people, they constantly told me that they built a community around them to support them, and that's what made them more likely to succeed. So engaging their friends and their family and their neighbors. And so I started to think about that, and we ended up creating a local initiative called Shape Up Rhode Island, which was a direct-to-consumer program, a nonprofit where individuals could pull in their family and their neighbors, and we had a statewide competition for who could exercise the most, lose the most weight, and so forth. And it was a broad-based coalition of community organizations and universities and all different types of government agencies. And what was interesting to me is that the people and the organizations that got the most excited about it were employers. And the employers just jumped on and they started to put their employees in it. They started to pay for their employees to be a part of the program. And that's how we started down this path of serving employers. So I think there's an interesting interface between employers and the community. And what I found through my work over the past 7 years is that a lot of employers are actually very focused on what they can do to bring what they're doing out of the walls of their corporation and into the local neighborhoods and the local community. They want to be a good citizen. They know that a lot of their future employees are going to come from that community, and so they want to invest in it. And I think we're seeing a lot of employers bringing wellness programs out of the boundaries of their workplace and into the community. I think one great example of that is the Cleveland Clinic, which offers wellness programs far beyond their employees and out into the community around Cleveland, where individuals who might be at a large company or at a company that offers wellness programs can actually sign up and be a part of it. I'm also seeing that as we move to a world where people are buying insurance directly from their insurance company, whether it's through an exchange or otherwise, the health plans are starting to adopt more intensive and more engaging wellness programming to offer directly to the member, to build loyalty, to build a relationship, to keep their members healthier, and to differentiate against other products that might be out there. So I think we're going to start to see people who maybe buy insurance directly on their own be able to have access to great wellness programs through their insurance company.
Hey, Elisa, I know that Kaiser is always up to a whole host of innovative things, but I know that you guys have been active in this area in the state of Colorado, making these kinds of wellness programs accessible to people across the state. Would you please comment on that?
Sure, and I just to add to especially what Rajiv was saying is that absolutely that folks can be involved in the community, and the local Y, there's runs, there are running groups, there are lots of support groups that are out there, and at Kaiser Permanente we're doing a lot of things to support the communities. I mean, whether it's anything from hosting races to, in Colorado, I think you might be talking about, we had a Weigh and Win campaign where citizens around the Denver area can go in and literally stand on a scale, weigh in, and get their picture taken, and then they go back and they have it was a contest in terms of how much weight they would lose. And then the other big thing that we're doing is that we are very active with schools, and in fact just this week we are launching a new program called Kaiser Permanente Thriving Schools, and the idea is that that schools are the hub of every community, and that every community has a school. There are good portions of the community that either work, or obviously the kids that are there all day, and there are a variety of programs that that we have been working on over the years, and some new ones that we are launching, including a new program this week that we're launching called Fire Up Your Feet with the Safe Routes for Schools, and where it is about getting kids to walk to school and having their parents do it with them, and having contests between the schools in terms of how much walking they end up doing. So all these things are out there in the community that anybody can participate in, and I think there's lots of avenues outside the employer workplace itself.
Great. Shuma, what are your thoughts on this subject?
So I love the two models that have just been described, and I would say that that what you see in a place like Rhode Island or in Colorado, it equally applies to West Africa, to Sub-Saharan Africa, to Asia, and in places like that, sometimes a large employer is really the only game in town. So if you look at West Africa, a large extractive company might be the only place where employees and the communities have access to a health clinic. So we see from a lot of our member companies a lot of engagement both in the workplace, but then extending that beyond the factory, beyond the company fence, and into the community. And I think it's really powerful, and it's a demonstration of how a company can be a good corporate citizen, both for its employees and into the community.
Terrific. And again, this is another great question, and thanks for, I'm happy we were able to get this kind of interaction and that kind of, rich question. But let's move on to the next question, because again, it's such a fun, big topic. There's a bunch of different areas we need to get to. So this is a question from Dr. Kavita Patel. This is also on Twitter. And, it's interesting. We've talked about employers, and a lot of what we talked about was sort of larger employers and the programs that they're running. And then we sort of flipped over 180 degrees and talked about freelancers and people who are individually sort of, looking for these kind of programs on their own. But then there's that in between, and I think the in between area is always one that we struggle with in healthcare, and that's related to small businesses. So Lauren, I'd just really like to get your thoughts on, how do small businesses fit into this picture? How do medium-sized businesses fit into this picture? Health and wellness programs, thinking about how to implement these things, how to do it, the risks involved, et cetera, et cetera.
Sure. So what we found is that small, medium, large, jumbo, extra jumbo businesses really, it doesn't matter their size. If they've got the commitment, from senior leadership and middle management to support this type of program, then they have as much of a chance of success as large employers do. We find that the key success factors apply across the board, regardless of size of industry or employment office. You know, you have to have that buy-in. You have to communicate effectively and targeted to individual needs to address what they're looking for. You have to have programs that work. You have to make sure that people understand what you're asking of them and what's in it for them to be successful. So we really don't see a change necessarily across employer sizes. What we do find, though, is that the smaller employers tend to be able to create a quicker sense of community and also impact cultural change a little bit better or easier than the large employers. We find that large employers typically we have to work to build a network of champions within the smaller groups to make that program successful, whereas a small company, we can go direct to employees very easily and not have to have that intermediate or middleman to champion the program for us.
That's terrific. You know, it's interesting, again, the whole notion of how you develop some kind of network or social support for these issues, I think comes up again. It's a really interesting point on, you know, how maybe, you know, smaller or mid-sized employers are able to do something a little more flexibly. That's a really great point. Lisa, what are your thoughts on this subject?
Well, you know, small employers in some ways, it's kind of binary because some of them think you're crazy and saying, I'm running a whatever kind of shop or a business, and why are you talking about the wellness of my employees? I just need them to show up. But more and more of them, when really get it, because when their employees are unhealthy, and whatever that means, that they are not coming to work because they're sick, or they're coming but they're distracted, or they're not doing well, they actually get the immediate feedback about the changing underlying health of their employees in a way that the large employers, it takes a lot longer for them to get that feedback. So I have actually seen that the smaller employers that get it and do something and really change the environment, they are the best evangelists out there, because they feel it. They don't need to see ROI data. They don't need trend data. They look on the floor and they understand what it means to be productive. So I think it's very hopeful. It's just not a lot of small employers have sort of drunk the Kool-Aid yet.
Great. And you know, this question with small employers, you know, often it gets at sort of resources, infrastructure, those kind of issues. Jared, what are your thoughts on that, particularly, you know, as someone who helps, you know, do the kind of work that you do? Jared, I think you might be muted. This is one of the
apologies. Yeah, I was actually going to say exactly that. I think that when you are a smaller company, you obviously see the change a lot more rapidly than a large corporation. You also have the added benefit of having the flexibility of being able to try things to see what works. Obviously, the time that it's going to take a corporation to choose any one wellness program and to have it effectively rolled out across all of the employees is considerably longer than a company with 10 employees who could try something on a very, very small scale, and if it works, they can keep it in place.
Yeah, we've actually seen some of that at Fitocracy. It's interesting. You know, we're a team of 8, and not everyone who joined Fitocracy, not everyone who we employed was actually very much into fitness. But we had a culture of fitness because of myself, my co-founder, and Jared. We all, you know, regularly exercise, and so fitness was really the norm in Fitocracy. And what we saw are, I can think of 2 examples, and you know, specifically, our Android developer. When he joined, he was about, let's say, 80 pounds overweight. 6 or 7 months into Fitocracy, he dropped 60 pounds, just because, you know, fitness was the norm in our company. Same thing with our iPhone developer. He previously never strength trained. He didn't really run that much. He never really went to the gym. And over the last, I think over the last 2 months, he's been winning in terms of having the most points in Fitocracy out of all 8 of us. I don't think that this would have been possible at a large company, in the sense that, you know, this culture of fitness was so powerful that it really impacted everyone at a you know, personal level. So I think that, you know, on the upside, small companies actually have a higher ceiling when it comes to this kind of thing.
It's also, I think, a little infectious in a company of our size. So typically, if you see someone sitting across from you suddenly getting all kinds of results from changing up their fitness program, it becomes immediately apparent to everyone else there that their performance at work has increased, they're feeling better, they're looking better, and at that point, you know, it becomes a little more obvious to the person running the business that they should think about instituting this across the entire network.
Great. You know,
If I can just add to that, just on this topic, you know, I think it's a great challenge for all of us to figure out how to tailor wellness solutions and drive interest and accessibility at the small and medium employer level. Because the truth is that most Americans work at small companies, right? Most people don't work at a Fortune 500 company. And so the small businesses of our nation are actually the sleeping giant. And if we can awaken them and get them to see the benefits of wellness programs, as many are starting to see, and we can give them tools, because the truth is most wellness programs aren't available to really small companies or they're not financially feasible. If we can figure out how to get the solutions to them, we can actually have a massive impact on the health of a very large population of Americans.
great. You know, it's interesting because, you know, I like this progression because we started out talking about incentives, particularly in financial incentives. And so then we moved through, you know, the notion of how do social networks and social support influence that. Now we're getting into issues of culture, issues of scale, the interface between, you know, organizations and individuals. Again, just speaks to sort of how, one, interesting and two, complex this whole subject is, and how we really need to, I think about it in this more sort of fluid way. So thank you, everyone, for the answers. The next question comes from Med Directors Forum on Twitter, and this is always a very difficult question, one that frequently comes up, and it's the following. Are employers seeing a reduction in healthcare-related costs after launching wellness programs? And Lauren, I'm going to ask you to start off answering that question, as challenging as it can be. Lauren, are you on mute?
Oh, no, sorry, I didn't hear that was to me.
Yes, please.
Sorry about that.
You could share your thoughts, that would be great.
Sure, so absolutely. So I think there's two sides of the story in that one, in that, you know, wellness at the workplace, if it is in causing behavior change for individuals, may actually cause an increase in medical costs as you see preventive visits go up, as you see more frequent annual exams. You know, claims data shows us that that may actually turn in counteractive to what we're thinking. But we also find that in a long-term case, that as people improve their behavior, they take more measures to address their health issues, their chronic disease and their high-risk state typically will migrate down to prevent them from having catastrophic medical experiences that, you know, could multiply and expedite the increase in cost for healthcare. So there's, you know, two sides of the coin that you can look at. If the cost increase is due to prevention, then, you know, that may not be such a bad thing on the employer.
Great. And Shuma, what are your thoughts on this, you know, with the different parties you work with?
So we have examples from our members where they've seen a reduction in costs after implementing a wellness program. One program that has been recognized by various parties, including the National Business Group on Health and other folks, is Lafarge's Building a Better You program, and this is actually a program in North America. And that program, since it was instituted in 2006, they've actually seen the per employee per year cost of managing diabetes go from $9,000 to $6,000, and so that's a 27% reduction in cost. So that's just one example of where an employer has seen the return on investment.
Okay, great. Elisa, what are your thoughts on this? Particularly, what kind of data have you guys found on this question of what kind of returns people get for their investment, so to speak, and what kind of returns those are?
So a couple thoughts about it. That it obviously depends where you start from in terms of what the health and the engagement is of your workforce. And one example is smoking rates. So in California, where I am, the smoking rates are significantly lower, about 10 or 12% compared to the rest of the country, which is up to 18, 19%. And our own membership is even lower than that in terms of smoking rates. Smoking is one of the things that has the first or fastest returns on medical costs. That when you go from smoking to not smoking, the medical benefits of that show up pretty quickly. So again, it depends if you have a population that where there's a lot of smokers and they quit. There is data that shows that that there can be a reduction in it. So there's lots of factors about baseline, but then the basic answer I always say is that it takes a long time, because we are talking about undoing what is decades in the making in terms of habits and obesity and other issues. And the wellness programs, the employers have to be willing to really stick it out in the long run, because it could take years to just even raise awareness about what the issues are, and then years to get participation. And even when people are participating, they may or may not be really changing their underlying health behaviors, and then once they change them, they have to sustain them, and then they might be preventing diseases that would have otherwise happened, and you're talking about changing a significant population. So I believe that there is the payoff, but if someone starts the conversation with when am I going to get a lower rate, and will I see it next year, then I know their head's not in the game in terms of understanding what a long-term engagement this has to be.
Okay, great. Our next question comes from Stacy on Twitter. And this is a really fun, creative question. I'd like everyone to sort of, put their creative thinking caps on. And what are some of the more unique wellness programs or interventions that you guys know of or come across? Things like, I know some employers, really facilitate, yoga in the workplace and things like that. So I'll just throw this out to Jared and Richard, just to start out with, again, this doesn't necessarily be employers, but what are some of the most unique creative programs that everyone's aware of?
So I can think of one example. Like I said, at Photocracy, it's part of our culture. We don't really have a formal program, but there are some startups that are in the health and fitness space that are doing some pretty innovative things. For example, there's a startup called Greatest, and they have a health awareness program where they make it a point to go to yoga, I believe, frequently, and try other things. So they'll frequently set a time to go to a Zumba class because people have never done Zumba before, and they'll set that time. They go as a group. The company pays for it, and that really instills a culture of fitness and health within the organization. I believe they do other things too, where you're not allowed to, or they require that you have a vacation time, and I mean that makes a lot of sense for mental health, which is one thing that a lot of people neglect when they talk about health overall. And when you think about the startup world and people working hundreds of hours every single week, mental health and making sure that you're not constantly stressed out all the time is something that should be taken into consideration as well. So I mean, there's some pretty innovative things that I've seen companies like Greatest and whatnot do, and I think it all comes back to just instilling that culture.
Okay, great. And Lisa, what are you guys doing at Kaiser on some of these really creative, pushing the bounds kind of programs?
One of the ones I really love is something that came out of UCLA. It's called Instant Recess, and the idea is that you have a recess on the books, on the clock at a workplace, and we've actually tested it with our own employees in call center environments, in a lab environment, and actually, believe it or not, even on an ICU floor in one of our hospitals. And the idea is that it's pretty simple, that you stop what you're doing, someone puts on music and leads everybody in a 5 to 10 minute dance, and so it is an instant recess, and people are out there dancing, getting their blood pumping, and it has had just amazing results in terms of certainly equalizing and taking the tension out of the workplace, because when you're doing the chicken dance with your supervisor, suddenly things are a little bit less tense afterwards, and people feel invigorated. They've had interesting results, and we have too, with people coming to work more often. And it's one of these things, talk about low tech, you just need a boombox and the creativity and someone with the guts to start dancing. So actually there was a great story that there was a patient in the ICU that heard every day that the staff was doing this instant recess outside on the floor, and part of that patient's inspiration to get out of bed was she wanted to be wheeled out there and participate in it because she heard everybody having fun for that period of time. So that's one of the ones I really love.
Wonderful. I love that. It's a terrific story, and you know it's also fun because we did that earlier in the prior Google Hangout. I took a little exercise break, so
excellent.
It's nice to have things round out again. So we're unfortunately, and it's been a terrific discussion. So many good points brought up during the day, and we could continue this on for a long time. But unfortunately, we're going to have to start wrapping things up. So I don't know if anyone has any closing quick thoughts. If they do, please let us know. Other than that, we might just sort of talk about some next steps. But does anyone have any final closing thoughts that they'd like to share? Rajiv, do you have anything to finish up with or close off?
I think what this conversation kind of illustrated is there are some really big questions that still need to be answered, and there's no one way to accomplish any of the goals we're trying to accomplish, but that forums like this are really essential, and we need as wellness leaders to find more ways to come together, to share best practices, to share what we've learned, to learn from each other's failures, and to collectively develop some best practices, whether it's for employers or community programs or for individuals. I think there's a hunger for guidance and for evidence and for someone or some group of people to help show the way, and I think we have the opportunity to do that. And I think this is a really great event. I'm proud and privileged to be a part of it. Some really amazing thinkers on today's call, and I think we should continue the conversation and continue to learn from each other and push this conversation forward. It's hard to get a lot done in an hour. We probably need 1,000 hours, but I think this is a really good start, and kudos to TEDMED for hosting this event.
Great. Lauren, your final thoughts?
Yeah, I think this is a really exciting time for wellness. We've got, people are starting to stand up and consider it as an actual business decision and not just a nice sort of touchy-feely thing to do when you have a few extra dollars in the budget. So we've really got a great platform to hopefully reach these large groups of individuals where they spend the majority of their time and address their behaviors and hopefully improve their quality of life and their health. So thank you again for the time to participate in the panel, and we definitely look forward to doing so again.
Jared, final thoughts?
Yeah, I guess the one note I really want to add is why wait? It feels like we're really at a turning point from both a corporate level down to a user level where this sort of preventative fitness rather than clinical healthcare is really coming into focus, and there really is no reason to wait anymore. There are some really great apps out there, some really great knowledge, and the time to start is now, whether you're on your own, whether you're a small company, or whether you're at the enterprise level. You need to kind of grab the bull by the horns and get on the ball.
Great. Shuma, what are your final thoughts, particularly from a global perspective?
Well, first, I just want to echo what everyone said. This has been a great hour, and thanks to TEDMED for giving us the opportunity to share both lessons here in the United States as well as globally. And I would just add one thing which didn't come up in our discussion and isn't really in the category of innovative or fun, but is definitely very, very important, and that is CEO level engagement and leadership on wellness programs. And so I think it would be great to see CEOs of major companies doing those dance breaks that were described earlier. So.
All right, and Elisa, your final thoughts to close it out?
Great to be here. Thanks for including us, and we should continue the conversation. I agree that the more employers understand the power that they have to make the change, the better. So, good stuff. Thank you.
Okay, great. So again, this is such a complex, rich subject. We could talk about it for months. but our time is coming to a close, unfortunately. But that's only for our current session, because fortunately the conversation on this topic will and can continue with your participation at TEDMED.com, and that's on the Great Challenges page for the Inventing Wellness Programs at Work. So please share your thoughts on that page. You can also ask comments, make questions on TEDMED's Facebook page or on Twitter. Use the hashtag Great Challenges. And again, we'd welcome everybody's input. Please join us next Thursday for our live event, and we're going to be talking about a really important subject, faster adoption of best practices. How do you really diffuse innovations? That's a real challenge we have in healthcare, wellness, medicine. And that's going to be at 1 p.m. Eastern Standard Time. And then we're going to be talking about the causes and effects of sleep deprivation at 3:30 Eastern. And again, it's another great topic that affects so many people, and it's such a really big ding on quality of life around the country. And finally, we'd like to say thank you to the Robert Wood Johnson Foundation for sponsoring the Great Challenges program. The generous support has allowed much of this to happen. So thank you, everyone, finally, for participating, for the great questions, for the active engagement. That's really what this is about. So with that, I'll say goodbye and have a good day, everyone. Thanks.
Thank you.
Thanks.